members. Okay, got it. It's being recorded. One of the intentions is to orient all of you to the college and what the college can do for you. But also, what's most important to me and why I'm passionate about this event is it's to welcome you or to honor you in your journey into preventive medicine. For a lot of us, I know for me, it was a really windy journey. There wasn't so much clarity. There weren't great mentors. Like wasn't very clear like what was happening next. And I felt like it was all on my shoulders to figure that stuff out. But through ACPM and relationships I developed there, I realized it didn't have to be that way. And we've been building this community that's so powerful. I have so many strong mentors and colleagues that, as we constantly revise our mission, as I constantly revise my purpose professionally and otherwise, there are people who've become like my closest friends that I've met through the college. And a lot of that comes, from choosing to be in preventive medicine because it attracts people like us. It attracts people who are really values driven, who really care about, not just working in the system, but working on the system, thinking about things more upstream, bringing about innovation, like trying to bring about health and not just managing the status quo. So you get some really amazing people in this field. And it's a crime, in my view, not to create the opportunities for people to connect with each other. So that's one of the main things we're trying to do here today as well. So my name is Prasad. If you can't tell already, I'm very excited to be here. I joined ACPM because my program director forwarded me an email from somebody, maybe Anita, saying, "Hey, get your residents to join." But I stuck around for all the reasons I just described. This ACPM has become such a rich part of my professional journey, and just contributing to the field and some of the advocacy work we do. There's so much opportunity to help advance the field and also just figure out what's out there to grow. I've just learned so much from being a part of the college. I've been exposed to growth opportunities that I think, really wouldn't have been present, leadership opportunities, other things like that, if I didn't really jump in or have people encourage me to do that. So to me, it's all about just reminding people, hey, this is a place where you belong. You get to meet your colleagues, you get to connect with opportunities, and that's what we're really trying to kick off here. So, like I said, we're committed to building a community at ACPM that really fosters a sense of belonging. At its root, I think belonging has so much to do with health and what we're doing to like advance healthcare, health equity. A lot of that is, how do you belong? And I think for us as individuals in this journey of like advancing preventive medicine, we need to belong to something. And ACPM is that something. It's that professional home that we belong to. So we're really committed to building that community. And this is just a super exciting time for people in residency or early career folks, because under Mirza's leadership, Dr. Rahman, who you'll hear from in a moment, we're going to be reestablishing these resident physician sections, early career sections. There will be lots of opportunities for all of you, if you want to step in and help shape the future of ACPM and to really step in to leadership in a very meaningful and significant way in our field. So we'll be talking about that throughout this session. So, I don't want to talk for too long because we started a little late, but I do want to remind you that this session is all about you. So, we're going to have some Q&A later. So if anything comes up, please just jot it down. We'll have time for it. And, we know that finding your way into preventive medicine, it can have a lot of twists and turns. It can be challenging. It can be unclear, what your next steps are. If there's one thing you take away from this session, just know you're not alone. There are a lot of us who've been through it already. There are a lot of you that are going through it together. And, to the extent that we can help each other on this journey, we are successful as a profession. So with that, I will pass it on to Dr. Mirza Rahman, who is the current president of ACPM.
Thank you so much, Prashad. Welcome, everybody. This is a delight for me to welcome you all because this will be the last time I'll be able to welcome a new batch of folks as president, because next year when the new batch starts, the college will have a new president. So I'm so delighted to welcome all of you and also to congratulate you that however you've come to preventive medicine, we're so happy that you're here with us. Some of you are straight out of medical school. Some of you have taken paths along different ways and you found yourself here. And we hope that you'll join us in a community that is supportive of you and supportive of what you would like to do professionally. My background and training, I'm a family physician, and then I have spent most of my time in the world of preventive medicine. As Prashad said, my name is Mirza Rahman, and I've been the president for the last year. I've got until May of next year when we meet in Seattle. I hope to see many of you there. I have been trying to meet with various residents and residencies. One of the good things, if anything good came out of COVID-19, is the opportunity to do these Zoom type meetings. And so I've been able to go to a number of places via the internet. I have, however, made it to some live. I've done some at Stony Brook and Naz, Dr. Bacher, you'll see she'll talk. I met with her and her team over in Rochester. And so there are some of the things that I'm able to do and meet with folks. But what I wanted to talk with you about is a little bit about preventive medicine. When we think about preventive medicine, sometimes we get this misconception that it's a new field and that, you didn't hear about it. I didn't hear about it until I was in halfway through my family med residency, as it were. And there was a department of preventive medicine at Stony Brook. And so it wasn't until then that I heard about it. And I ended up completing that after I had done family med. But as I said, I made my home here. And why did I do that? Well, it's primarily because of the work that I did. I've worked for the last 2.5 decades in the pharmaceutical industry, mostly in pharmacovigilance, but in a variety of other areas. And this has been my home professionally, and it's allowed for growth and development and camaraderie and leadership opportunities. And those are all things that are available to you. I remember going to my first conference probably back in 94. Is that too long ago for some of you? Yeah, it's probably too long. I see some smiles. But going to the first conference, 94, 95, and sitting in the back, because as Prashad said, you know, you weren't sure what you were doing, who these people were, where you fit in. You didn't have any idea of how this was. And I remember sitting in the back and somebody was talking, and when you're in your 20s, you can be a little snarky. I'm sure none of you are, but some of us were. And I said something snarky, and this person who was sitting 2 seats away from me, she whipped her head around and looked at me. And then about 5 minutes later, she said something snarky. And Dr. Rika Mayashiro and I have been delightful friends for the last 30 years. And it all started then. About 10 years later, her husband, Dr. Michael Parkinson, and I were in a conference and on a panel, and she goes, I'm sitting in the back making fun of both of you, right? And so these are the kinds of friends you have. And I've had friends like that, not only with Rika and Dr. Parkinson, Mike, but a number of other people. I've met younger folks like Dr. Acharya. I met the staff. I think you will learn that the staff is one of the best assets that we have at the college. I see online our interim CEO, Melissa Ferrari. Anita Balan is the one, if you haven't seen that she mistakenly sent her name out to all of you, I see there's 4 Anita Balans. You might want to change it, the 3 dots in the top right, to put your name on, although she may have a number of siblings that we're learning about. Dr. Acharya was just talking about cloning. I reminded him it's still illegal. We try to do only legal things here in the college. And so it's important that you get a sense that we take the work that we do very seriously. We don't take ourselves too seriously. The college has been around since 1954. And as I said, folks like Melissa and Anita and Cara, who leads the conference, which I hope you'll come to in Seattle, the conference planning, we have been doing this for 70 years. We will look to you all to carry it on for the next 20, 30, 40 years. And then you will teach the next group of leaders who come along. And there are myriad ways in which you can participate, in which you can grow and develop, whether it's through conference planning, whether it's serving in a committee, whether it's serving as an officer, on the board, as a regent. And then, in your own career, do you present at a poster or at an oral presentation, deliver a workshop, serve in a plenary. These are all opportunities for you to take advantage of and to make sure that we help you to get done what it is that you would like to get done. And we won't know that a priori, and you won't know what we have. And this is why we're having a conversation today. And I will allow Miss Ferrari to present. She has that name only because that's the only car she's ever driven. She is connected to the family, and I will now turn it over to her. But let me close again by saying welcome. I'm delighted that you've chosen to join the specialty of preventive medicine. Looking forward to doing what we can to help you achieve your goals as preventive medicine physicians. And it'll be great to have you ask questions as we go through. I just realized I think Dr. Beecher is next, and I will turn
Yeah,
it over
thank you
to her.
so much for that, Mirza. That was great. I had those similar experiences of, but my experiences at the conferences were much more recent than yours, let me tell you that. And
You
so we're
try
gonna
to
hand
call
it
me
off
old
next.
appropriately. Yeah, nice.
We're gonna hand it off next to Naz Beecher, who has had her first conference more recently than us to help kind of orient us for this session.
Oh, thank you. It's actually Becker, but you know what?
Okay.
The president's allowed to call me whatever he wants.
Dr. Becker,
Um,
I
I
apologize.
thought so.
that's that's okay. Yeah, so I just graduated from University of Rochester, preventive medicine residency, and much like most of you, probably had a circular path to preventive medicine and public health. Just quickly, I think I became disillusioned with the role of physicians when I was an intern at Shock Trauma, and I was involved in creating a startup company, but then I got a little bored of that, and I miss seeing patients all the time in the hospital setting. So one of my close attendings, she suggested preventive medicine, and I had never heard of it before. So long story short, I met Dr. Acharya and Raman last fall when I gave a very nerve-wracking presentation to the board for ACPM. And, Prasad took me under his wing, and everyone was extremely welcoming. So congratulations for making it this far. And I think if you're looking for a home in terms of career and life in general, you can make lifelong friendships. ACPM, unlike AMA or some of the giant organizations in medicine, is small enough that you can make a pretty big impact. So I think that has the biggest draw for me in terms of time commitment. So that's about it for me. And feel free to reach out if you have any questions. Thank you.
Thank you, Naz. That was great. If you want to put your email in the chat or something like that, that would be cool.
Sure.
So yeah, just kind of before we hand it off to Anita, who's gonna kind of go focus in on ACPM's offerings, especially as they relate to early career folks. I just want to say, make a plug for all of the committees. All of our committees are open to residents, which you'll hear about. We are starting these resident sections, early career sections. So, if you're interested, you can really hit the ground running. We'll be sharing some information about how to get involved with that if you're interested in being a part of the leadership. And, just as a plug for the membership committee, I'm the chair of the membership committee. If you're a people person, if you're creative, if you like to get people engaged, similar to what we're trying to do here, or if you just want to grow as a leader and you just want to be a part of a team that feels connected and motivating, feel free to reach out to me. I'll put my information in the chat and we'll find some projects that you could get involved with. One thing we're thinking about imminently is how do we start like a preventive medicine interest group for medical students that's really kind of run by residents and early career folks that helps medical students understand about the field. So, we have a saying on the membership committee that we don't want preventive medicine to be an incidental finding. And so that's what we're really working on. If any of that type of stuff sounds interesting to you, feel free to reach out. So I'm going to hand it over to Anita. But before I do that, I'm going to ask each of you to, in the interest of really being a professional home, which means you can go and knock on somebody's door. You can say, hey, are you free to grab a cup of coffee or something? I want well, let's put our name. I put into the chat, name, your program and year, any areas of passion related to health or medicine, and your email or your LinkedIn if you're interested in being in touch with others. We'll just share that information here. And while we're working on that, I'll hand it over to Anita, who will walk us through the college offerings.
Thank you, Dr. Acharya, Dr. Raman, and Dr. Becker for setting the tone. Again, welcome everybody. My name is Anita Balan. I'm the Director of Residency Engagement and Development, and you'll probably hear from me for a while because I provide staff support for residency programs and program directors. But it is my distinct pleasure to now turn it over to our the captain of the ship, our interim CEO, Melissa Ferrari, to provide you with some welcoming remarks, and then we'll go over just a few slides highlighting what we have to offer, along with another introduction of another colleague of mine. So you'll meet 3 of us today, including our CEO, so that we want to have bulk of the time after that for you to once again connect with one another, get to know each other. But welcome aboard, and with that, Dr. Melissa, take it away.
Thank you, Anita. And, being captain of the ship, so to speak, I guess that means I can drive a Ferrari, which I don't. And it more accurately probably describes the pace of my life than the car that I drive. So, but, I wish there is a connection. It's way back, but apparently there is one. So thank you, everyone, for joining us tonight. It really is an honor to have you spend your valuable time to learn more about ACPM. And as Dr. Acharya said, your professional home. I know your life has gotten a little busier lately, so taking the time out to learn about ACPM and how we can better support you is so important, and we appreciate that. For nearly 4 years, I've had the opportunity to be part of the ACPM staff and to support preventive medicine and learn about all that you do and all that the specialty offers. For much longer than 4 years, I won't go into how much longer, I've served as an association executive and really had the opportunity to represent a number of industries and professional societies, from bankers to math teachers to neuroscientists to physicians. And throughout that time, I've worked with a number of volunteers. I've supported a number of missions that are all aimed at really making life better for people in one way or the other. However, being part of ACPM and supporting our mission and our members, I've really witnessed a level of passion, which I think we've seen already tonight in the few minutes that we've been together, but a passion not only for improving the health in populations and in individuals, but a passion for our members to really nurture, support, and grow the future of the specialty. And if you see my newsletter article today, you'll see it really aligns with that message and how important it is. And as Dr. Acharya and Dr. Raman both said, being able to access those mentors and those individuals that really help them in their careers. And Dr. Becker will look back on her nerve-wracking presentation and be grateful that her former PMR director, Dr. James Tachi, gave her that opportunity to really step into a leadership role, and she knocked it out of the park. She did a fantastic job in front of the board. So this meeting is really part of that synergy. And our goal tonight is just really to help you learn more about ACPM, to learn more about each of you. That's a really important part of this gathering, is because we want to know why you entered the specialty, and we really want to know how we can best support your needs. And it gives us the opportunity to help you grow professionally and personally within the college. And I think Dr. Acharya mentioned the leadership opportunities and how those doors will open for you. And our goal is to help you succeed in your career. So with that said, I want to take a few minutes. I think Anita has some slides for us that we'll walk through to talk about some of ACPM's initiatives and how we can best support you and help you get engaged. You've heard us mention the resident physician section. This is something that the college had for many years, and I was in meetings today where these sections, our resident physician, our medical student, and our young physician sections all were referenced and really emphasized what a role those being part of those sections played in shaping the career of the individual. So we're excited to be bringing them back. As we've talked about, we encourage you to get involved. They will be formed so that you have as much opportunity to be engaged as much as you personally want to be. And so there will not be a lack of opportunity, and there'll be certainly be leadership roles. But one of the things that's unique that was not the case when we had the sections earlier is that now there will be a role of a board liaison who actually will be able to engage in board meetings and have a voice. And that's a new position because we feel that having the voice of these sections will be important to help shape the strategic direction of the organization. We'll also follow up and have volunteer forms, which, speaking of volunteers, we can go right to the next slide. So you will have volunteer forms that you can submit to show your interest to be part of the sections, but that's only one piece of where you can contribute. And we've referenced our committees. We kind of have what we call two sets of committees, committees of the college and committees of the board. What you see listed here are committees of the college. And as Dr. Acharya said, he is our chair of the membership committee. And there's just opportunities on each of these to serve. And again, we recognize your time is valuable, but your voice is important. And being able to either contribute to a policy statement or a position statement, being able to help create programming for the conference, being able to participate in Hill Day or help to plan a webinar, like those are all different types of tasks and initiatives that come out of some of our committees. And the list is endless. What's not listed here are a couple of our committees of the board that we also have resident representation on. And one opportunity is our finance committee, which, especially if you're looking more at administrative level for your career, is a great opportunity to kind of dive in and learn a little bit more about managing some of those finances on the back end. But then also our governance committee. And NAS has joined that group recently and is going to be supporting us, and they help to review our bylaws and to make recommendations to the board, as well as our policies, and plays a role in our nomination subcommittee for selecting the leaders for the organization. We also launched this year a special interest group in 3 areas. You'll see them listed there, starting with the pharmaceutical medicine, AI and digital health, and global health. Information about each of those are on our website. You can also reach out to membership at acpm.org if you'd like to be involved with those. We will be launching a new platform. I'll tease it a little bit within the next month. That will be an online community forum, and that'll be especially important not only for the sections, but for these special interest groups as well, to be able to dialogue and talk about topics that are really relevant to your focus and to your career. And then we have several task force. You see a couple listed here. The visibility task force was key in recently helping us develop a This is Preventive Medicine campaign. Those resources I will highlight. I think Anita might be covering them later, but I'll just emphasize that that group was really helpful in developing the messaging and the tools. As it's been said earlier, people kind of happen upon preventive medicine. They don't know about the specialty. And so, and sometimes it's hard to explain what it is. And those resources are all there, and we've used them as part of our campaign. So I encourage you to work on your elevator speech for talking about your career path and to tap into that. And again, the Visibility Task Force was an excellent opportunity for those leaders to come together. So with that said, we have so much more to share with you that I would like to turn it over to Cara Molinari, who's a Director of Medical Education, and she's going to get you excited about some of the resources you have available, and including our annual conference. So Cara, take it away.
Thanks, Melissa. Hey, everybody, I'm Cara Molinari. Just think of it as like calamari when you say it all together. I'm the Director of Medical Education at ACPM, and I help develop or facilitate, I should say, all of the educational content you see online and for the live meetings. Our forefront is the annual meeting. It's like our Super Bowl. This is basically propelled by some of the abstracts, ideas, and policies that are happening year to year in PrevMed, and we get to feature them in very unique and special ways at our annual meeting. This year, as Melissa had referenced, it'll be in Seattle, Washington. You can see our abstract due date is the 25th of October, and the poster due date is the 9th of December. So sometimes we do have the opportunity to, if there has been an oral submission, we can then migrate it over into the posters. But point being here is I've worked at 6 specialty medical societies, and any of the abstracts that came in usually were what was, the basic incentive for whatever content was featured at the annual meeting. What's unique about PrevMed and about our volunteers and our leadership is that Dr. Rahman made reference to an alliterative term before. It's PrevMed is a place where policy, population, and patients can all come together as one. So we have our leadership meet, and what's unique is they can have ideas for what are featured at our plenary sessions, and then also consider how to infuse some of the abstracts and the science that we receive through our portal. We have 4 tracks this year: Advances in PrevMed Specialty, Community and Population Medicine, Clinical PrevMed, and Environmental and Global Health. So we are offering discounts for any ACPM member residents, and also we have a scholarship fund from the kindness of Jacob Adams, who just recently passed, to come, and those proposals will be due on January the 10th. If I could have the next slide, please, Anita. Thank you so much. We also have some other platforms that should warrant your attention. We have sponsored and co-sponsored journals. We have the American Journal of PrevMed. We have ACPM Focus, who this year's actual chair, Dr. Yuri Jadot, is the primary editor for. We just created, well, not just in my time at ACPM, a 10 Essential Public Health Services course. But I would welcome you to look at what we have online for our board review courses. We are still the #1 go-to for preparation for sitting for the PrevMed boards, and that is due in large part to our faculty expert, Dr. Jill Wallen. She stays on top of things. She helps write the in-service exam, and in addition, helps us develop all of the content. We just actually blossomed from 12 core lectures to 20 this year so that we could include what is included on the new ABPM blueprint. So anything you need to know about the boards, anything you'd like to know, please feel free to reach out to me. I'll put my name and email address in the chat as well. We also have online learning and certifications. We have a military environmental exposures certification course, which is very popular with any member of the VA, any actual practitioner. You could be, mid-level providers. You could be, physicians in training. You could have nothing to do with being a physician at all whatsoever. But it is a certification that is becoming a mandatory process for any and all who are involved with health delivery at VA institutions across the United States and their territories. And with that, we also have coming up a Dan Blumenthal lecture on health equity, which will be happening on October the 9th here in Washington, D.C. And we have a lifestyle medicine core curriculum, which we do jointly with the American College of Lifestyle Medicine. That will be retiring in 2026. So I would welcome you to look at that and some of the core competencies that we have featured there. But we're also working on another course with lifestyle medicine that's going to be focused towards the physician. I don't want to monopolize any more of the time, but I'm more than happy to discuss any of our educational offerings with those of you who are interested.
Thank you so much, Cara. And again, as my colleagues mentioned, we want to have maximum amount of time available for you to connect and network with one another. So I'll just take less than a minute to quickly say that we've got a lot of evidence-based deliverables available on our website. And this webinar is being meeting is being recorded, and I'm happy to share all of these resources with all of you, including anything that you may want to incorporate as part of your rotation. You can advocate for the specialty by participating on our Hill Day and taking part in the Action Center and making your voice heard to our lawmakers and being an ambassador, essentially, again, developing your skills to make your voice heard and, for preventive medicine and any area of prevention that you want to we are passionate about. As Dr. Becker said, this is about you, and you can make this college your professional home and, you know, really improve your portfolio however you choose to. So we have so many options. But I do want to kind of end with this particular slide before I turn it over to Dr. Acharya. We've got some wonderful events coming up, including early career speed mentoring sessions that we started earlier this fall under the leadership of Dr. Acharya, to kind of learn from your fellows in the college about how to navigate. We've also got career conversation webinar series. As you all probably know, each of you probably have 20 different paths into preventive medicine. And it's really wonderful to kind of get some insights from some of the more seasoned physicians who've been in the field for many years. And so it's been a request from a lot of our members. And so we started that this year. We've got one coming up later this month, focused on preventive medicine and cancer care, more on that. We've also got a career center that's more than just a job board. So you can take advantage of the QR code there. And recently, we just launched a series of 12 webinars on public health emergency preparedness. And there you're going to get plenty of notice and registration and reminders about that. So more to come on that. To help you to upskill when it comes to public health emergency preparedness and response. With that, now for the most exciting part for you all to get to know one another, Dr. Acharya, I'll turn it over to you. I think you're on mute, Dr. Acharya.
I sure am. Thank you so much, Anita. If you could go back one slide, I just want to place an emphasis on the, if you could go back to your previous slide, Anita. So yeah, that early career speed mentoring session, I believe that's November 14th. Is that correct? We have that date finalized. So mark your calendars. That should be in the evening, and we'll get information out about that. But we really think that this is something of incredible value, you know, to people in residency, just to meet fellows of the college, people who are doing different things, to ask, you know, questions in a space where no question is off limits. So we're aiming for quarterly, and we take any feedback from any of you. So if there's a particular area you want to focus on or something, just reach out to us. You know, you can email us at that membership@acpm.org email address. Or reach out directly, and we'll try to work in your recommendations. Another thing in this section, you know, just not to belabor the point, but you know, we are restarting the resident section, and that's going to be an incredible opportunity to connect with leaders in the college, to, you know, help grow your own leadership abilities, and to shape the future of the college. So you know, that's another thing that definitely aligns with career growth that should probably also be on the slide, but, you know, not an oversight, but just another point. All right, so now for the fun part. So we thought it would be important, you can go to the next slide, that, you know, you all are in training, and some people train in programs where it's just one or a few people. Oh yeah, you can take it off. I'm sorry. It's one or a few people. And, you know, we think it's important that people in preventive medicine know each other, and, you know, we're often doing the same things. I remember when I was in my program, I felt like, oh my gosh, if I could just talk to somebody who is doing the same thing and like we could collaborate, you know, like that would make this so much more fun. And it was just so hard to do, you know? So we want to break down those barriers, connect you with each other. So what we're going to do, we were thinking about doing a larger group thing, but just given time and some other factors, we're going to do breakout groups. And so we'll try to aim for no more than, how many people do we have here? We have like 20 or so.
I think we have about 20. Yeah.
Okay. So maybe groups of 6 or something like that, like 5 or 6. Okay. And then the invitation is, you know, really to be resident centered. So, you know, I'm going to be in one of the rooms. Mirza's going to be in one of the rooms. You know, Melissa might be in one of the rooms. Like, you know, the point is for not for us to talk, really. So we're just going to help you guys connect with each other. And the fundamental question is, like, who are you and what brought you here? You know, how did you find your way into preventive medicine? Because for a lot of us, it's quite a personal story. And I've found that hearing people's story around this is powerful. And if not, you know, just what are you passionate about, or where is it that you want to head in this field? So we'll do that and just get to know each other. Feel free to share, you know, contact information, make those connections. It's really important in our field. So Anita, whenever you have a chance, if you could set up the breakout rooms, and
I'm creating them right now. I think I'm going to be creating 3 rooms. So that you know, there's about enough people to interact with, not including
great.
staff, and yeah.
And we should do this for about like 15 minutes or so, 10 to 15 minutes.
Mm-hmm. Okay, and then. Okay.
I'm noticing how many people put down lifestyle medicine as an area of passion. That's cool.
All rooms are open. Have fun.
Going in as people trickle in. Just curious, we did a fun little exercise at the end. But just how was that? Maybe put it into the chat. How was it connecting with some of your colleagues? We had a
Let
crazy
me just jump
situation.
in. Let me just jump in first and apologize. I thought we only had 2 people in their group. I'm so sorry to the other folks. When I pulled out the screen, I saw about 3 or 4 others. So I'm deeply apologetic about that. I'm sorry. We can certainly connect at another point. I'm so sorry because the screenshot that I have didn't have everybody, and I didn't make it all out. Anyway, sorry about that, folks. And nobody else seemed to pick it up.
So guys, that was awesome in our group. I hope it was really cool in yours, even in Mirza's room. So I'd like to, just quickly, are there any like themes of questions or things that you'd like us to cover in the future? If you have any questions that are coming up for you, go ahead and put them into the chat. And we'll, try to address them, either reaching out to you or, maybe if in the few moments we have left. But if there's anything you'd like to know that we didn't hit in this session, just put it in the chat. Send us, membership@acpm.org. Send us an email. You can email me or Anita directly. So we just want to make sure there is space for that. I think we kind of use the time a little bit differently. So I'll just kind of see if any questions roll in here. And
I think one of
while
the questions that, oh, sorry, go ahead.
Oh, go ahead.
See,
Go
there's a
ahead.
hand raised, Christy. Yeah, go ahead.
Oh, I don't see that.
A literal hand, and not the usual
Oh,
yellow.
got it.
Oh, okay. I was looking at the Zoom as well automatically.
Okay.
Who raised their hand? Whoever raised their hand, please go ahead and unmute
Christy,
yourself.
go
Oh,
ahead.
hi, Dr. Goel. Go ahead. Welcome aboard.
Good evening. I was just curious if you could get a recording of the first couple minutes. I didn't realize what time the meeting started. It was on me, but I was wondering if it was a recording.
Yes,
Yeah.
we're recording. Yes, absolutely.
Okay, thank you so much.
Okay, fantastic. So seeing no questions, I do want to kind of honor the time, the end that we shared. So first of all, I just want to thank you all for joining. We know that residency is a busy time. There's a lot going on. This is kind of a strange hour. If there's any recommendation you have around timing, we could do separate sessions at different times to kind of hit people on different coasts or whatever with different schedules. Let us know what works for you, what kind of programming works for you. As we spin up the sections and have like a board liaison and connections to the membership committee, we'll have a lot more input that we can integrate into our programming. So just want to thank you for joining this time. Definitely keep your eyes open. You're going to be seeing some material about leadership of these new sections. So like keep your eyes open. There'll be a form to fill out, and there's a process in place. If you don't see anything, or if you're kind of wondering what's going on, just feel free to reach out to us. And just coming up here, wanted to let you know, here's some kind of resident specific programming we have coming up here, this career conversation session. with Dr. Algatar. He's really into lifestyle medicine, so I saw many of you were, so that could be very interesting. He's an academic, I believe, at University of Arizona. This preparedness webinar, we have this speed mentoring session, which I'd highly recommend joining. If there's specific areas of interest that you want us to pull somebody in on, feel free to let us know. We can, kind of reach through our networks and make that happen. Really hope to see you guys there and hope that that's a regular fixture throughout all of your training, that you get to meet fellows in the college in various areas. And so, just wanted to conclude by saying, there's in the civil rights movement, they would have a saying that they signed at the end of their messages, and it was "the struggle continues," which sounds like kind of like a little bit tricky, or like kind of like, wait, what's that? But I find in preventive medicine, in general, there's never a place. I see a lot of people who, yeah, I'll come to you, Mirza. I see a lot of people who, feel like there's like a final destination point. And I hate to be the one to break it to you if you haven't learned it already, but there is no final destination. This is an ongoing process. And to move through this process, we need each other. And so just so grateful that you're joining and becoming a part of this group. If there are any ways we can help make the group better, just raise your hand and be a part of the change. I can tell you a lot of things that I've contributed to were not, it was really, really different like a couple of years ago. And I've seen the impact an individual can have. You can have that impact too. So if there's any way I can support you in that process and your leadership growth, reach out to me. I'm happy to be a part of that journey. And Mirza, why don't you close it out for us?
Sure, but before, Anita was raising her hand.
Yeah, there was a question, Dr. Ms. Ferrari, and I'm calling you doctor now. You are to me. But Melissa, I think there's a question. I want to make sure that we're answering accurately. Is there an ACPM directory where we can see the names, locations, work positions, and emails to contact each other, not only residents, but all doctors, all ACPM members? And I believe the answer is that if you are an ACPM member resident, and you should be able to look up other physicians who've opted to be a part of the directory who are also part of our membership, not just residents, but they would have to opt to be a part of the directory. But I believe we are continually reminding members to make themselves available and to update their profiles. And so we should have, I don't unfortunately have an estimate of how many number of physicians we'll have in that directory. I don't know, Melissa, I'll turn it over to you if you have any additional information.
Anita, I think you hit it. And then, as I mentioned, the community forum.
Yes.
That's launching within the next month. That too will have access to those who have interest areas. So completing your profile so you can kind of match up and have access is really important. And you'll see that message throughout the newsletter and other areas, but that's going to be a great connection for you to find those mentors and to join communities that have topics of interest.
Thank you, guys. And Mirza, why don't you close us out with some parting words of wisdom?
Thank you. No pressure, right? So 3 things. One is you're new to preventive medicine. Let's encourage you to join the resident physician section. That had been where some of us started. It had terminated about 4 years ago. We're bringing it back thanks to Prashad and the membership committee, and the staff is working on it. Jump right in there. I think that's a great place for you all to get started. If you're more ambitious, you want to join a committee, let us know. We're always looking for folks who are interested in committees. And in particular, the program planning Preventive Medicine 2025 conference is always looking for folks. And I think for there, yes, you do give service, but you also learn. You also learn how things are put together. You learn by reviewing an abstract. How do you write an abstract? So those are opportunities that I'd encourage you to take advantage of. And you also get to connect with people who you never know can serve as mentors for you on an ongoing long-term basis. The other thing I want to say is, if it's okay for the people who I feel I've shortchanged because I didn't see all of you, I'm happy to stay on for any 5, 10, 20 minutes. If people want to ask questions who were in that group, maybe Anita, you could leave it open. I'd be happy to stay on. I have a 7:30 meeting. I'm on the East Coast, so I'm happy to chat with anyone who wants to stick around. No pressure if you got to go. I understand their dinner and kids and all of those things. I'm old enough that my kids are well grown and gone, so I don't have to worry about that.
Awesome. So let's just make that clear. So even if you weren't in Mirza's group, you're welcome to stay and, speak with him for the next 20 minutes or so. And as we close out kind of this official session, thank you so much for joining. We're looking forward to seeing you next time. And let me tell you one thing I've learned, kind of in this group and in other groups, if you keep showing up, eventually you'll be like really integrated into the thing. So just keep showing up. Take care for now. Bye-bye.
Thank you, Prashad, and Anita, thank you for organizing.